Should I just ask? You guys just want to go into questions? Sound
Sure.
good? Okay. Oliver, sorry.
What would happen if somebody cut their eye?
Well, it depends on how bad the cut is. If it's just on the top surface, sometimes that happens. Like anybody have a scratched cornea before, scratched eye? That'll heal up pretty good. Sometimes we have to treat it and help it with some medicine or like a bandage contact lens, but it usually gets better. Yeah.
What happens, like, do you have something, like if somebody loses their eye? I'm just thinking about this from a movie scene too. Somebody loses their eye, can you like put a fake glass eyeball in, or what do you do if they lose their eye?
So if they totally lose their eye, it doesn't work at all anymore, or it needs to come out because it's hurting them a lot, then yes, they do put a fake eye. Now that fake eye doesn't work, it doesn't see, it doesn't hook into our brain. You guys know where our vision center is in our brain? Where is it? Can you point at it? Right back there. Yep, so it doesn't hook into that or anything, but it looks nice. Yeah.
Looks
Yeah, we'll go over here. Hey. Yeah.
How come when people are blind, their eyes cloud?
Not everybody who's blind has a cloudy eye, but some people. It just depends on what is causing the be blind. If it's the cornea, that's our front clear window we look through. If that's the reason they're blind, then it would look cloudy. Yeah. Yep.
Why do some people who are blind keep their eyes shut?
So I would say most people that are blind probably don't keep their eyes shut, but some could, because maybe it's painful to have them open. There can be some reasons for that, like if their cornea, it's that front surface again, if it doesn't work very well, that's why they're blind. Maybe it hurts and it feels better closed. Yeah.
What's better for your eyes, glasses or contacts?
You know what? They are both equally good. It just depends on what that person has going on and maybe what's best for them. So I have some kids that like to try contacts, and then some kids. Are you wearing them? Was it kind of hard to learn how to get them at first? Yeah.
My mom's pretty good.
You just got them to like yesterday, didn't you?
Oh,
No, I
man.
got them on Saturday.
Saturday.
Oh,
Okay.
really recent. Yeah. You'll get more used to them, I'm sure. Yeah. Quick.
What first inspired you to be an eye doctor?
You eye doctor? Well, I knew I liked science stuff, like what you guys are learning. That was my favorite subject in school. And then we had a friend of ours growing up that was an eye doctor. And so I got to know it more that way. And the more I got to know it, the more I thought, I think I would like to do that. Plus, I think I was in 3rd grade when I started to need glasses. And that helped to promote it, yeah.
So I got 2 questions.
Yeah?
So, how do blind people get checkups for the eyes?
Just same way regular people do.
And so,
What do you think about it? If you think about it, raise your hand again. Okay. Evelyn?
how many years do you have to go to college to be an eye doctor?
So you have to go to what we call undergrad first. So that would be like a college like Simpson. That's where I went. So you go for 4 years there and probably get a degree in some kind of science. And I chose biology. And then you have 4 more years of optometry school. And then if someone was going to be an eye surgeon, they might go for 3 or 4 more years.
So about 8 to 12 years?
Kind of depends on what they're doing, yeah. Now, eye surgeons go usually to a different school. They go to med school first, so they learn about lots of parts of the body, and then they specialize in doing eyes. And that takes 3 or 4 more years, yeah. Kurt?
How come if you're blind, the colors aren't normal colors and it just turns black and gray? Why? Like it's still blurry, but how come you don't see the colors and it's just still black and gray? And have you ever dissected a human eye?
Not a human eye, but
A cow eye?
And
cow
have you
eye.
ever used a device to see inside the
Yes, we do use it by subset. And people that are blind, so if we use the term blind, do you guys think that term means no vision at all?
No.
It could, but most of the time it just means not very good vision.
But like,
So so they can still see colors.
Yeah, but like people that are like fully blind, they can't see anything at all. How come it's not just blurry? How come it's just black and white and they can't see the colors? But it used to just be like really, really blurry.
I would say most people who have vision problems, and we might say are legally blind, they still have color vision.
Do you guys remember that cat though, where we saw like it was actually a picture of a cat, but it was just lights? I think that's what he's saying. Like most of the time, it's not completely black.
Yeah, it wouldn't be black. Oh, I see what you're saying. Black, not colors, but
Yeah.
totally black.
And I have one last question. In the back of the eye, how come when they dissect an eye, how do they get that like blue stuff or like the stuff that makes their eyes glow in the back?
Like on animals, the
Yeah,
red.
Oh,
like
the animals.
cow eyes.
Yeah.
Yeah.
Or like humans.
How do they have it?
Yeah.
Well, they're just made that way. And they have that to allow more light in, because some animals, as you know, are nocturnal. You guys have heard that one, haven't you? And that helps them collect more light in their eyes so they can see. So, Brander,
When you put eye drops in your eyes, where like the eye drops go?
where do they go? So they, depending on the eye drop, it will go through the cornea. I say the cornea a lot. That's this part right here, right? So it will penetrate through the cornea, or parts of it do, and then they might, depending on what we want it to do, it might connect to the muscle here, which is the iris, and the ciliary body, which is this part, or it might go all the way back here to the retina to do something. So it kind of just depends what that drug's supposed to do.
Yeah.
Yeah. Yep.
Has anyone's vision been so bad that they have to wear contacts and glasses?
Yes. Doesn't happen very often, but it can happen. I better go to this side a little bit.
So, like, I know if your eyes are too big or too small, you have like blurry vision, but what causes like color blindness?
So color blindness, have you guys heard of genes or genetics
Yeah.
before?
Yeah.
Yeah, that's very important.
mix of blood and DNA.
Well, yep, it's just kind of how our body's blueprint is put together. And sometimes there can be a defect in that, and that can cause a color vision problem. And that's inherited. And we can track it very closely through the grandparents, through the parents, and then to the kid. We know exactly how it'll go.
Yeah,
For color vision, it's one you can do that with very easily. Yeah, what do you think? You got a question? Yeah. Yep.
So I have two questions. So, what is one of the worst problems and what is the most normal problems you've seen with
Well, that's a
eyes?
good question, yeah. I'd say the most normal problem would be people needing these or contacts, right, to help them see
And-
better.
Also, why do our pupils get bigger and smaller even though there are holes in our eyes?
So if our pupil got really big and we were out in the bright sun, it would be really hard to see because all that bright sun comes in. Has anybody ever had their eyes dilated before? Yeah.
It's terrible.
That's when we make it big on purpose, right? And then if you have to go out in the sun, it's hard to see anything. So we are made so then our pupils will get small when we're out in the sun to not let all that light in. But at nighttime we need that extra light. So then they get big again. Isn't that pretty cool how we're made? It's an amazing miracle, really.
These guys have, they've been working with models of retinas and lenses, and I would love one of them to tell you their theory, what we figured out, and you tell us if we're right or not about why people have vision problems. So who wants to explain it to him and see if we're right, or he might give us some feedback on our model.
Okay, go ahead. You want to tell me?
So we made these models and we would put them in like darkness and we'd put it next to a window
Mm-hmm.
and you'd take the model with like the lens inside and you'd have a white piece of paper and you'd like if you push it like close enough and far enough away then it would show the picture upside down.
Yeah.
But if you put it too far it just gets blurry and if you put it too close then it's blurry too. So you have to have your eyes perfectly in the right spot to be able to see what.
Do you know that's exactly what our glasses do for people that need it? So if have you heard of nearsighted and farsighted before? Yeah. So with one of those, the image is too close to our retina and it's all fuzzy. The other one is too far away and all fuzzy. And the lenses put it right where it's supposed to be so we can see. So that was a really
They
cool
figured it
experiment.
out from working with the model. Why it shocked us. We thought for sure there was like some sort of physical damage, but
Yeah.
just structural
Just structural.
most of the time.
Yeah, it has to do with refraction. Refraction is how light passes through something. So the first refractive surface is our cornea. That's the biggest one. Light enters through there. And then the second one is our lens. And so between those two and the length of our eyeball, that's what makes up our prescription. Yeah, in the blue shirt there.
Why when you see something, it's upside down?
So that is true. When it ends up on our retina, it is upside down. And then our brain turns it the other way. It's pretty amazing, isn't it? How our brains work and our eyes together. Yeah. You got a question?
Do you ever get
No, but I did when I first started. You know, when I was in school, then it was a little weird when you touched your first eye. But yeah, I've been doing it a long time now. So, yeah.
So, what, do like animals, deer when they, or like pets, when they go like to, would they get their eyes checked too? Like, can animals be blind?
Yeah, they can be blind. Do you know what? There's a veterinarian. You know, veterinarians help animals, right? The doctors of animals.
Yeah.
There's a eye doctor veterinarian at Iowa State. I think he's the only one in our whole state. Yeah, and he might do surgeries on our pets.
So he has to be very busy usually.
I think so. Yeah, he has some students that help him. Let's see. Is anything else? Yeah.
Like, what is in eye drops?
Lots of different things. So there's one thing that's in a lot of eye drops called preservatives. And that's so our bottle of eye drops doesn't get bacteria in there that would, if we use it, get an infection. The other thing that's in there, the main thing, would be whatever medication that we need it to do. So some medications are things to help our kill bacteria, and another one might be to help inflammation. That's when we get swelling. So they can do different things.
Like, how do they make coffee?
Oh, so they have these really cool machines that produce them. Yeah, and they have different companies use different ways, but yeah, good question.
Which one do you prefer, glasses or contacts?
Well, I've worn both in my life, and I've liked both of them. Now that I'm older, glasses are easier for me. 'Cause I have something called a bifocal.
Ha.
Have you heard of that?
that?
Are you making fun of old people?
Shouldn't laugh. Someday that'll be us.
Yeah.
Is it true that, like, because I've learned this something before, I think I don't know, but is it true that, like, when you were looking around, there's one little blind spot that our brain goes into us?
That's true. So if we only use one eye, we do have a blind spot. It's where our optic nerve, which is right here, connects into the retina. We don't have vision right there. But guess what? Since we have two eyes, they fill in for each other. So when we have two eyes working right, we don't have a blind spot. Isn't that cool? How that works? Yeah. Let's see. Who has it? You wanna ask it?
I have two.
Okay.
First, why do blind people that are actually blind and they can't read, why do they use a stick and glasses?
Well, I think not all of them use the glasses. Some of them do. They use that, I think, to show other people that they have a hard time seeing.
And I have
The
another
stick
question.
helps them get around so they don't run into stuff.
I have another question.
Yeah.
How do you guys take out the eye?
Well,
It's like people-
thankfully, I have not had to do that. That's more for those eye surgeons we talked about, but I've had to send some patients to have that done.
And I have another one. Why do people wear those like big eyes they have, like those little ones that are like skinny? Why do they put it in their eyes?
Are you talking about like contact lenses that have designs on them or something? Oh, I think they just do it for fashion. Like some people wear different kinds of things.
Like they don't have like an eye, like an actual eye. Like
Yeah.
like they don't have like a pupil or
Oh.
an iris. Some people put like a fake pupil.
Yeah,
and
we
a
would
fake
call that,
iris.
have you heard of the word prosthetic?
Yeah.
That would be called a prosthetic contact lens, and it makes it look like they had a normal eye.
So they don't.
You can be born without a proper iris, maybe, and so we do that sometimes. That's true. Yeah. How about a blue shirt back there? Cute. Yeah. Yep.
How come like when people are cross-eyed, when they put on glasses, it doesn't look cross-eyed anymore?
Probably because their eyes aren't crossed anymore. Some people have to have glasses to keep their eyes straight. Sometimes they have a prescription, and I think some people in this room probably, if they didn't have it on, their eyes might work so hard, they cross.
We
the
actually talk
glasses.
about this cross-eyed thing a lot. Is that an urban legend about the hitting on the back and the?
That is.
They are always bringing that up
Yeah.
about you could go
Yeah.
cross-eyed. So
Yeah.
yeah.
That is not true. So if you're having fun with your friend and your eyes are crossing, and someone hits you in the back of the head, then your eyes won't stay that way.
Yeah.
That's
Dang,
good news.
that's happened to me. So you have to have the perfect eye length. I'm asking questions, but you have to have the perfect eye length to have good vision. What is the eye length?
What is eye length?
Yeah.
Yeah. So what is the perfect eye length?
Yeah.
That will vary because remember, it's not just the length of our eye that matters if we have good vision. It's also the curve of our cornea and the lens here too. So it has all those things together. So someone could have a shorter eye, but their cornea is just the right curve where they don't need glasses. And someone could have a longer eye and their cornea is the right curve where they don't need glasses. So there's several factors that go into that.
And my other question is, what happens if you scratch a contact lens and put it in your eye?
If it's just a tiny scratch, some people can wear it for a little bit. We usually would recommend just throw it away and get a new one though, to be safe like that.
How do you determine if somebody needs glasses or not?
Well, there's a couple ways to do it. A lot of you have had your eyes checked before, probably, right?
I do.
I mean, that's right. And so we might put an eye chart that has a bunch of letters on there, and they're big, and then they go smaller, smaller, smaller to really small. That can really help us out too. A lot of times it's just by talking to you, I can tell. You might say, when I'm looking at what Miss Camp's writing on the board, I have to squint really hard. I have a pretty good idea probably what's going on then. Yeah, yep. Yeah.
What happens if you need glasses and don't?
Well, so you could have headaches, you could squint a bunch, or it could be dangerous and you're not seeing things that could cause some harm to you, like running into stuff, or maybe you can't read your work and do well at school that way. Yep.
What's the most common injury you've seen with the eye?
Just injuries. I would say the most common injury would probably be corneal abrasion. So abrasion is when you get a scratch and when you get it on the cornea. And they hurt really bad. If anybody's had one in here?
Yes,
I had both my eyes.
Yeah, they can hurt pretty bad. Good news is most of the time they heal up really well if they're not too deep. Yeah.
Is there anything better than 20/20 vision?
There it is. Yeah. So you can be 20/15, which is better, and you can even be 20/10. So that means, so let's say somebody has perfect vision. We rate that they're at 20 feet away from the eye chart and they see what they're supposed to. Someone has 20/40 vision. The person with perfect vision can be way back at 40 feet. And the person that doesn't see very well has to be up to 20 feet. Yeah. So the smaller the number, the better the vision. 20/20 is kind of our goal. But some people can be 20/10 once in a while. Yeah.
How many people per day have to get glasses?
That I see in a day?
Yeah.
Okay. I would say, so it depends on the day, but I'll see somewhere between 18, 20 people a day. And so I would have to say probably like 75% to, yeah, probably about 75%. Other people might be coming in for other reasons though, maybe not for that. They might be coming in for eye health reasons. Like we talked about scratched corneas and stuff like that. Well, who hasn't asked a question? I think you know this. How about you with the planet shirt on? You haven't asked a question.
How can you be blind? How can you like not see well in one eye, but you can see much better in the other eye?
Well, that can happen because sometimes the eye forms differently on one side than the other. And that can cause something called amblyopia. That's a big word. Some people say the word, some people use the term lazy eye, which isn't our favorite word to use. Amblyopia just means that eye doesn't see very well. Maybe it's got a big prescription and the other one doesn't, and then the brain doesn't like to use it very well. So we can do some ways to make it work better. Abram? Got a question?
Who conveys you see you down for work?
What do I do after work?
Yeah.
I come home to you.
So
Play with
these,
you.
do you guys know that these are his sons right here? Abram and Everett. Abram's in 3rd grade and Everett's in 5th. Give me a thumbs up if you know these guys already. Awesome. Now, boys and girls, we have about 5 minutes left, so I want to make sure everyone gets at least one opportunity to ask a question. So if you've already asked one, hands down. If you haven't asked one, hands up, and you want to.
Come on, gray sweatshirt.
How do you test baby guys because they can't say
Hold on one moment. I can't hear his question because there's other people that aren't Lucas talking.
Say it again.
How do you test babies' vision because they can't say letters?
That's right. That is a good question. So there's 2 kinds of testing that we can do. One's called subjective testing. That means we ask you questions. Which is better, 1 or 2? Can you do this? Can you do that? And then for babies, they can't do that, right? And even little kids that are 2 and 3 years old can't do that very well. So we have to use something called objective testing. So we'll use some lights. Like if I wanted to see if a baby needed glasses, then what I do is I shine a light in their eye, and I have my lenses. I can hold the lens in there, and the reflex I get back, I can tell if they have a good odds of needing glasses or not. It's kind of neat how it works. Yeah. How about you?
What do when you put them in there, I forgot what they call it.
Contacts?
Contacts. Oh, why do they have water in them?
Well, so our eye has a lot of water on it. It's called our tear layer, and that's how our eye works. If we don't have any tears, we're going to have some major pain in our eye, and we're probably going to go blind because we have to keep it moist. And so contacts have to have some moisture to them as well. Yeah, it has to be moist. Yep.
This happened to me, but why does sometimes when you're in a bright room, your pupil goes small, but the other one's big?
Well, they actually will work together. So now some people can have some eye problems where one is bigger and the other one's not. They could be born that way, or they might have an eye disease that does that. So I'm guessing that it was just how you looked in the mirror at that time that it looked that way, but it probably wasn't really that way. That can be kind of tricky. See, who didn't ask a question? Yep, back in the black sweater.
Can you also use machines if people need glasses?
We do. We use a lot of different kinds of machines. Some to check eye health stuff, some to check if they need glasses. Yeah. Let's see. Did you ask a question? Okay.
How about 2 more questions? Let's
You
see.
did do a pink sweatshirt back there? Yeah.
Your voices are all boys and girls. Grayson.
What's the strangest thing you've ever dissected?
Dissected? Well, I don't have to dissect a lot of stuff anymore. So I was in a class at Simpson when I was going for my biology degree, and they had a human body of someone that had passed away. It's called a cadaver, and they donated their body so we could dissect the body and kind of see how everything worked. That was kind of amazing. There was 3 different bodies. There was 2 women and 1 man. Yep. Red sweatshirt.
What would happen if someone's eyeballs came out?
If their eyeballs came out, oh, that'd be bad news. Like all the way out on the ground. Like, well, you know what?
Oh, let's find our common 3. Find your common 2. Uh-oh. Find our common 1.
So our eyeballs
0.
can't really come out because they're attached to a lot of different things in there. We talked about this optic nerve, and there's a lot of connective tissue around it, and there's 6 eye muscles. So there's a lot of stuff to hold it in there.
Okay, boys and girls, we will make more questions that we can email him, and I bet he'd be happy to answer those.
Yeah.
I'd love for him to finish by telling us, if you are interested in this stuff now, maybe an eye doctor, maybe another kind of doctor, any kind of scientist, what advice would you have for these guys? And then I'm also curious if you did see anyone after the eclipse that had looked at the sun.
Oh, yeah. So, what advice would I give you now? I would say pay attention in science class because it is super interesting for one. Isn't it? It's amazing to see how things work and how our bodies are made. It is cool. So if you like that, look up stuff on your own too. I mean, maybe with your mom or dad. And then try and just, if you're interested in something, keep checking it out. Do some, what we call research on it, right? Yeah, and as far as the eclipse, I didn't have anybody have trouble with this eclipse. We did have we had a lot of phone calls, but no damage.
Oh, good.
There was an eclipse 7 years ago. A lot of you guys
2017.
don't remember. Do you remember that one?
You guys would have been like preschoolers, yeah.
Yeah, that was more of a full eclipse on that one, and so we did have a few more people coming in actually.
Oh, coming in.
That was less partial and more full, so I think there's a little more staring going on there.
Yeah.
Did you guys learn about the wavelengths of light and all that? The good kinds and the bad kinds for us?
They were just real worried because they knew that when they had those glasses on, their pupils got huge. If you just snuck a peek, your pupils would be so big that it could be a problem. But what do we tell him, boys and girls? Okay. And can I get a picture of you and the boys together? You guys go up there by your dad.
That's why you put on my